Just for those of us who haven't spoken with you, what are you committing to releasing to the National Centre for Truth and Reconciliation?
Yeah, we have about a category, I would say, of 12,000 or so documents that deal with roughly 8 school narratives from 2. There are 4 orders of the Catholic Church that this government did not have the permission to release documents. 2 of them are defunct, but the 2 principal ones are the Sisters of Providence and the Sisters of St-Onge, dealing mostly with schools on the West Coast, and that deals with I'd say about 12,000 documents. I guess after the events that have all shocked the conscience over the last 4 months, it's led us to a rethinking of the position that we have as a Canadian government. The belief was that we were fulfilling the strict legal obligations of our duties to the National Centre for Truth and Reconciliation, but obviously knowing there's a lot of survivors that are looking for closure and any piece of information can provide that, we took a look internally and saw readily this group of documents that should be disclosed to the NCTR. And so that, go ahead, Glenn.
So I mean, the government has a requirement in all government documents to protect the privilege of third parties. It sounded like from the story today that you're not concerned about that in this case. I mean, do you have any kind of legal opinion that you can release these, and any concerns about liability for releasing documents that have confidential information that are confidential to other people?
Well, we're talking about the only reason they were not being released were by virtue of the fact that these religious orders were not allowing us to do so. I'm not going to presume at the outset that they won't, and indeed we've had a few indications that it should be fine. But I think it's time, and this is our duty as a government, a moral duty towards survivors who can, as a matter of closure, would need that information, and it's information that has been requested of us. There was no valid reason, and obviously all governments are concerned with liability, but there's an overarching need to think about this from the perspective of survivors, and that's why the decision was taken.
And when are the documents already in the hands of the centre?
It's about 30 to 45 days, David. They go from anything from school registries and narratives to detailed documentation. It's quite a voluminous disclosure process, so we said 30 to 45 days, but hopefully quicker, and I know the Christmas period's coming up, but it should be done relatively quickly.
And do you think by the end of the year you're going to be able to strike a deal with, on the child welfare situation, talking to, the discussions with AFN and with Cindy Blackstock, where are we at with that? Sorry,
yeah, and I'm not going to speak to it publicly right now, David. The talks are ongoing. They are very fluid, very dynamic. I believe positive, but there are some things to iron out. Again, this is a multifaceted process that includes historical compensation as well as achieving long-term reform. So, a lot of moving parts, a lot of people sitting around the table under the stewardship of Murray Sinclair, and it's something that as long as we're talking, it's positive.
You previously said your hands were tied by third-party obligations. What's changed?
Well, again, over the last 4 months, we've all had to look inwards and look at ourselves and look at the plight of Indigenous folks that are reeling, some still suffering in silence, those courageously speaking out as well, people suffering from intergenerational trauma. It's focused the inward look and the need to think more about closure that survivors would get, and their moral duty of the Government of Canada to disclose these documents. You may say that a piece of information that would seem pretty anodyne to most people might not provide closure, but I've heard enough testimonial from survivors to say, for example, finding out a record of someone at a certain place and time can provide a certain level of solace and closure for those people. And I can't presume to say that there's anything in there that will be helpful, but I know that it is information that we shouldn't be sitting on simply because we have third-party disclosure obligations to religious orders that were part and parcel of all the damage that's been caused.
What took this has been an issue for a while. I don't know all the ins and outs, but I haven't covered it that closely. But it seems if this is the morally right thing to do to release these documents, why did the government get sued?
Sorry, I didn't hear that last part.
Why did the government get sued? Why did it take so long to get to this?
Look, and you heard it from the Prime Minister himself in Kamloops, What you heard was clearly the belief that all the legal obligations had been fulfilled in terms of our disclosure to the NCTR. We knew that there was more documentation, and he said he would leave no stone unturned. This is part of the process. This isn't the end of the process. We're going to look internally at the way we invoke certain legal principles, see if they're being too broadly invoked, but that will take a little time alongside the Minister of Justice, the Minister of Indigenous Services, to look at the way we protect documentation with that moral lens, with the view that survivors need that information to move on. This isn't an issue of liability. It's about people trying to get some information and get a sense of what went on. And I think that's more important. There are, as your colleagues have alluded to, real and deep considerations to confidentiality. Some of this information does document very, very painful allegations, occurrences, facts. And it is something that the Supreme Court, in respect of independent assessment process documents, have said benefit from absolute confidentiality. So by no stretch of the imagination, people think this is an easy process. It will be difficult, but it's something we have to look at through the lens of the last 4 months, going over and above our legal obligations. Thank you.
Thank you. Thanks very much.
We are very, as New Democrats, we are pleased that the government is finally admitting their obligation to turn over documents relating to the crimes committed in the residential schools. It was preposterous for the Prime Minister to challenge the Catholic Church to turn over documents when we knew that the federal government was refusing to turn over key documents to the Truth and Reconciliation. These are documents that are needed for survivors, but also for the historic record, because what we're talking about is the attempted genocide of Indigenous people. These records will be super important in the coming years. So it's taken a long time for the government to admit that they have to turn over these documents. I'm glad that they're finally putting the interests of history and survivors ahead of the interests of protecting the other collaborators in this attack on Indigenous people, particularly the Catholic Church.
So you're not giving the government any points?
We have seen this government say they turned over the documents when we knew it wasn't true. We saw how a St. Anne survivor was told that she needed permission from the Catholic Church in order to even be able to talk about what happened to her. The government has not been willing to turn over any of these documents until we started to see these unmarked graves appearing and the growing pressure. It's been the tradition of the Catholic Church and the federal government working hand in hand, protecting each other's interests. Outstanding on top of these documents are the multitude of documents from the class actions that were being launched up to the Indian Residential School Settlement Agreement. There were many, many cases adjudicated. There's evidence. The government knows a lot more than they've turned over, so we're glad these documents are turned over. We're saying all the documents that are within the hands of the Justice Department need to be turned over. The police evidence, the court evidence, the records that they have of the known predators, all that has to be turned over so that we can get a full sense of the crimes and the systemic crimes that were committed against Indigenous children in this country.
Previously, they've said their hands were tied by third-party agreements. What changed?
The agreements that the federal government has had from the get-go has been with the Catholic Church. They have walked hand in hand on this. They have now recognized that this is not a relationship that has been helpful. We know that there's issues of the Oblates shifting documents to Rome. The idea that the Prime Minister had the gall to call the Catholic Church to turn over documents when they themselves were sitting on thousands of pages of evidence. What's changed? Well, once we started to find the mass number of unmarked graves of dead children, the government realized that they had to start taking this issue more seriously. This is not going to go away. It's not going to be swept under the carpet. This is Canada's historic reckoning. So those third-party agreements with the various church orders, null and void. History is calling for justice.
And explain why it's so important for the families.
We know in so many communities where children never came home, people are still asking questions. The very first time I ever went into the community of Attawapiskat, I was stopped by family members and said, nobody ever told us what happened to our uncle, what happened to our cousins. The documents are there. We know those documents are there. We need to have the documents turned over. It's not just for the survivors, but for the historic record, because Canada's role in the attempted genocide of Indigenous people is a historic reckoning, and the only way we're going to move forward as a nation, is to have those documents, to know what happened, and to be able to say, this is the true historic record and it will never happen again. Thank you.
Duclos, les États-Unis ont annoncé le boycottage diplomatique des Jeux olympiques de Pékin. Est-ce que votre gouvernement fait la même chose?
Écoute, nous sommes très inquiets avec la situation à la Chine. C'est une des options que le gouvernement va considérer et il faut protéger tous les droits des personnes.
Mr. Mendicino, on the quarantine hotels, we're hearing some troubling stories about lack of personal necessities. We're hearing stories about people being forced to wait while they already have their negative test result to get discharged. Why is it so badly organized?
Well, I mean, the first thing I would say is that we introduced these measures to protect Canadians, and Omicron is real. It's a concern.
But these are Canadians who are in the hotels.
Well, I was just going to try to finish the answer. We put the measures in place to protect Canadians. We have to buy ourselves some time to learn more about Omicron so that we can learn about its transmissibility. Most importantly, to learn about whether or not the vaccines are effective against it. And with regards to the additional requirements that we're asking of Canadians, we acknowledge this will require more time. And that people should be factoring that into their travel plans, but it's a necessary and fair trade-off to make sure that we are appropriately managing this new variant of concern.
Is being served rotten salads also necessary and not providing diapers to babies?
No, of course not. And the expectation would be that when travelers are going to isolate or to serve in a quarantine where necessary, where they're coming from one of the countries of listed concern, that they get access to appropriate food and accommodation. So,
est-ce qu'on peut s'attendre à des changements à la frontière des États-Unis dont les voyageurs sont toujours pas forcés de se faire tester quand même?
Notre approche pendant la pandémie est de suivre le conseil et tout l'avis de nos fonctionnaires qui travaillent dans le secteur de santé publique. Ça c'est le hallmark de notre approche. Et maintenant, tous les règlements et les mesures qui ont été mises en place sur le terrain à la frontière est nécessaire.
So on the quarantine hotels, it seems the government wasn't ready for the own rules that it put in place. I mean, people are appearing to not be given the required necessities while they're taken into quarantine. So what is the government going to do to make sure that is the case, or is the current standard of service what should be expected?
Well, we're not going to spare any expense or resources when it comes to protecting Canadians, including at the border, and we're going to continue to provide clear travel guidance to all Canadians and others who are traveling to and from Canada. Merci beaucoup.
Que le Canada emporte pas aux États-Unis avec un boycottage diplomatique de Pékin.
Le Canada demeure préoccupé par la situation des droits de l'homme en Chine. On est toujours en discussion avec nos alliés, puis pour le moment, il n'y a pas encore de décision qui est prise. Ce n'est pas une décision qu'on prendra à la légère. De mon côté, comme ministre des Sports, évidemment, ma préoccupation, c'est nos athlètes et le succès. Donc, dès qu'on aura une décision, on pourra vous la communiquer.
C'est qui les alliés avec qui vous discutez? Avec quel pays essayez-vous de vous mettre en groupe? Parce que les États-Unis, c'est un allié.
On discute avec tous les pays alliés traditionnels du Canada. So far, a decision hasn't been made. We are, of course, very preoccupied with the violations of human rights in China. It's not a decision that we're going to take lightly, and as soon as we have made the decision, we will communicate it to you.
What factors are you looking at? What are you considering? What's it based on?
The head of the WHO is a bit concerned that countries aren't accepting country of origin test results from the Southern African nations. What do you say to that?
Look, what we've committed to Canadians is to do everything we can to protect their health and safety, and that we have border measures based on the information and the advice that we receive. The reason why we've included this third country testing is to create some kind of a cushion between the time of departure and the time of arrival. And it's based on the advice that we'll receive. As we learn more about this variant, as we learn more about conditions, we could reassess. But for now, this is the rationale for putting a third country testing.
Minister Alghabra, some airports say they're worried that the new testing requirement for people coming into the country from abroad, except the United States, is going to create major delays during the holiday travel season. What do you say? Is that going to be the case?
I say I really am sympathetic to the anxiety that people have, that airports have. These measures are meant to protect the health and safety of Canadians. We're working closely with airports and Public Health Agency of Canada and CBSA to do it as smoothly and as efficiently as possible. But I also want to let Canadians know and ask for their patience and cooperation. This is a new system that we're implementing that may take some time to ramp up, but we're all in this together, and I ask for everybody's
cooperation.
Travelers
should expect delays.
Travelers need to be prepared for delays.
Thank you, sir.
Question about the head of the WHO says he's dismayed that that countries like Canada aren't accepting the original test results from South Africa, from the Southern African countries. You know, that Canada just won't accept those. What do you think?
Well, we obviously recognize that this is very complicated for everyone, including people in South Africa who are having a very harsh time. But we're obviously putting this into place not because we like that, but because we absolutely have to protect the health and safety of Canadians.
Le Québec vous demande 10 millions de tests rapides maintenant, le plus rapidement possible, qu'ils veulent distribuer avant les fêtes. Est-ce qu'ils vont les avoir?
Mais justement, ça tombe très bien parce que j'en parlais avec le ministre Dubé ce matin, il y a à peu près 2 heures, donc on va travailler là-dessus parce que c'est une demande importante, puis on sait à quel point les tests rapides pour les Québécois et les autres Canadiens, ça va être important dans les prochaines semaines.
Et les avez-vous? Est-ce que vous allez les envoyer? Est-ce qu'il y a une entente?
On s'entend pour travailler là-dessus et il y aura prochainement de bonnes nouvelles, je crois.
Sur un autre sujet, est-ce que vous pensez qu'il faut qu'il y ait un boycott diplomatique des Jeux de Pékin?
Un boycott de qui?
Un boycott diplomatique des Jeux de Pékin, des Jeux olympiques.
Oh, mais là, vous avez une bonne question. Malheureusement, la mauvaise personne à qui poser la question. Là, je vous encourage à poser la question à mes collègues là, qui sont davantage en charge des relations internationales.
Mais vous, personnellement, est-ce que vous pensez que ce serait une bonne idée?
Je crois que la relation, évidemment, avec la Chine et les autres pays, c'est une relation fondamentale, mais pour avoir une réponse qui satisfait à vos hautes attentes, je vous encourage à demander à mes collègues.
Et sur les aéroports, est-ce que vous avez une date précise? À Montréal, entre autres, c'est toujours pas en place, qu'on me dit, là, les tests dans les aéroports. Est-ce que vous savez à quel moment ça va l'être? Est-ce qu'on parle de encore plusieurs jours avant que ça le soit?
Bien, entre mercredi dernier et vendredi dernier, on avait déjà connu une augmentation de 60% de la capacité de tests à travers le pays. Il y a des différences régionales, évidemment, en tenant compte des situations aéroportuaires locales, mais ça va bien et au cours de la prochaine semaine, les prochains jours, là, on aura d'autres annonces sur des augmentations additionnelles de la capacité de testage.
And quickly on the WHO's Southern African business, how long will South Africa, Malawi, Mozambique, et cetera, be banned from travel and from their tests and so on? Like, is this weeks? Is this months? Like, it can't go on forever. So what sort of circuit breaker length of time are we talking here?
Well, we obviously understand the concern, and we would like to know the future. However, there is yet a lot of things we don't know about both the variant and the situation across the world. So my PHAC and the relevant health officials are working with the countries affected and with international partners.
Les tests, vous les avez donc, les tests rapides?
Merci, on va en parler plus tard.
Merci.
So I just wanted to ask you about the quarantine hotels in particular. I know you asked about the
U.S. travel rules, yeah.
And the U.S., but on the quarantine hotels, we're hearing stories in Vancouver and in Toronto that people, even when they have gotten their negative test, are waiting sometimes a day, sometimes longer, to get the official discharge notice.
Right.
They're not getting proper necessities like diapers, proper food, access to clothing if they're not able to get their luggage. Just wondering your overall take on this.
Well, these are really troubling stories, and this is the second time we've had border restrictions and travel rules in place and required the use of quarantine hotels. So you would think that the government would have contingencies in place to give people the proper care and concern while they're waiting for their negative tests. So I'm really troubled to hear the stories that we've all heard in the media about people's treatment, and I would hope that the minister would take immediate action to resolve those issues.
And should they be operating if they're not able to provide that level of service? Like, what should the level of service be?
Well, the government needs to provide direction. They need to tell these facilities exactly what's expected so that the Canadians who are returning home and are staying in these hotels and these quarantine facilities have the proper care that they deserve.
And does the NDP believe that these quarantine facilities should be used? Right now they're just being used for people coming from those 10 countries. Some health experts say it's not science-based, that it shouldn't be equal. So should they be used at all, or what's the perspective on that?
Well, the bottom line is that we need to keep Canadians safe. And so any rules the government puts in place have to be backed with the best evidence. They should be transparent about what that evidence is. And in the case where we are using quarantine facilities, the Canadians returning home should be offered the full care and concern that they deserve while they're awaiting their negative test results.
Okay, thank you.
Thanks so much.
Good afternoon. I'm Gord, Member of Parliament for Courtenay Alberni, and I'm the federal NDP critic for mental health and addictions. I'm here with our Deputy Leader, Alexandre Boulerice. Today, we're here calling on the government to take action on the overdose crisis that's happening right across our country. Over 20,000 lives have been lost since 2016, since this Liberal government took power. People, mothers and fathers and sons and daughters have lost family members. People are grieving right across this country, and all we've seen is inaction from this Liberal government. Right now, we know that people are united across this country. Health officials, coast to coast to coast, the Police Chiefs Association, medical experts, Mom Stop the Harm, calling on the government to implement simple steps, decriminalization, providing a safe supply, so that people aren't getting poisoned when they're using illicit drugs. We haven't seen the government respond with the necessary action and steps that are needed. And, we saw in the COVID-19 crisis, the government listened to health professionals when it came to making decisions to respond to that crisis. The Prime Minister cited that. He says that he understands this is a health issue. Yet, when we see the policies that the government brings forward, clearly he's not treating it as a health issue. He's ignoring those same health professionals when they're citing clear recommendations. His own government's expert panel on substance use that is calling for decriminalization, calling for an expungement of all records for possession. And the question is why? And we know that, the stigma starts, when people, with criminalizing people that are using substance use. So the stigma really starts with Justin Trudeau, who's maintaining the status quo while lives are being lost and our country's being torn apart. And we need the government to act, to save lives now. So we're calling for the Prime Minister to listen to his own expert panel, to listen to the big cities, Vancouver. We know that Toronto's examining today whether they're going to be calling and joining the chorus looking for decriminalization. The exemption that British Columbia is seeking, my home province. We've lost more lives from a poison drug supply than we have from COVID-19, yet we haven't seen any action. I'm going to turn it over to our Deputy Leader, Alexandre Boulerice. Thank you.
Merci Gord. Bonjour tout le monde. Effectivement, je suis ici avec mon collègue Gord Jones pour demander au gouvernement libéral de prendre des mesures sérieuses et cohérentes en ce qui concerne la crise des opioïdes et les centaines de personnes, les milliers de personnes qui ont perdu la vie au Québec et au Canada. Si depuis 1 an et demi, on traverse tout le monde ensemble une crise sans précédent qui est la pandémie de COVID-19, il ne faut pas oublier qu'il y a une autre crise qui sévit également dans nos sociétés, c'est la crise des opioïdes, où des gens perdent la vie avec cette consommation-là. C'est des intoxications qu'on voit et qui ne s'arrêtent pas. La bonne chose à faire, c'est la décriminalisation de possession simple des drogues. Il y a un vaste consensus dans les experts en santé, dans les recommandations même des comités que le gouvernement libéral a mis sur pied, que c'est une des mesures qui va le mieux fonctionner pour aider les gens. Les gens ne sont pas des criminels. Ces gens-là n'ont pas besoin d'aller en prison. Ces gens-là ont besoin d'aide. C'est un problème de santé, c'est un problème de santé publique, ce n'est pas un problème judiciaire. Alors, ça suffit, les demi-mesures, ça suffit, l'inaction. On veut que le gouvernement libéral fasse la bonne chose à faire. C'est simple, décriminaliser les possessions simples de drogue. Merci. On peut prendre des questions.
Il semble que le gouvernement va redéposer, si on comprend bien, celui qui essentiellement déjudiciarisait la possession simple de drogue. Pourquoi c'est pas suffisant à vos yeux comme étape?
Bien, pour nous, ce qui est clair, c'est que la solution, puis tout le monde s'entend là-dessus, c'est de décriminaliser. Je comprends qu'on peut essayer de déjudiciariser le processus, mais quand tu es toujours dans un processus judiciaire, même si tu arrondis les coins, tu es quand même traité comme un criminel, tu es quand même dans un processus judiciaire. Alors, que ce soit la déjudiciarisation du processus ou que ce soit la réduction des peines, c'est encore là. On ne va pas jusqu'au bout. On est frileux. On a peur d'aller au fond des choses puis de prendre des mesures courageuses, qui est celle que nous, au NPD, on met de l'avant depuis des années puis que Jack Mead met de l'avant depuis des années, même quand il était candidat au leadership du parti, c'est la décriminalisation.
Mais là-dedans, une des options pour les policiers, c'est de recommander un traitement. Donc, ça répond à cette demande-là de ne pas envoyer ces gens-là en prison, mais de peut-être leur offrir des services.
Ça peut être vu comme un pas dans la bonne direction. Le problème qu'on a, nous autres, au NPD, c'est que ce n'est pas un problème judiciaire, ce n'est pas un problème policier, c'est un problème de santé. Ce n'est pas un policier qui devrait aller voir la personne, c'est un travailleur social ou une infirmière.
So, Mr. Johns, you were hoping to see decriminalization in the bill?
Yeah, absolutely. We can't accept anything less. I mean, they tabled legislation last spring. It wasn't even a quarter of the way of what was needed. I mean, this government is, they haven't even declared a public health emergency. Over 20,000 people have lost their lives. It's been the worst public health emergency and crisis we've seen in generations prior to COVID. And again, in my home province, we've lost more lives to the poison drug supply than we have to COVID-19. Yet we haven't seen the government respond. No public health emergency. They're not listening to their own public health officials. They're not listening to the Police Chiefs Association. They tabled legislation in the spring that lifted mandatory sentences on people using drugs, still criminalizing people. Instead of, ending the stigma once and for all, treating it truly as a health issue. That's what needs to happen so that people aren't using poison drugs in the back alleys of our country.
Ça vous amènerait à voter contre ce projet de loi-là ou à voter pour en vous disant que c'est un bon premier pas?
On va devoir regarder qu'est-ce qu'il y a dans le projet de loi. Donc, la première chose à faire, c'est de bien le lire pour bien le comprendre. Nous, on dit, voici où on met la barre, voici c'est quoi notre exigence, voici nos attentes, qui sont celles du milieu de la santé puis des spécialistes, des experts. Pour le reste, on verra quand il y aura un vote.
Mr. Jones, have you talked to the government about perhaps the next step being decriminalization? Because Vancouver has asked for it, BC, like you said, BC has asked for it, Toronto is asking for it. Have you talked to them? Do you have any indication if they're still thinking about it?
Well, New Democrats have been putting that forward. We've been asking for the government. I met with Minister Bennett. I cited that she needs to approve the application that came from British Columbia and Vancouver. And again, we don't understand what the resistance is. We've seen other countries do it. Portugal, Netherlands, Switzerland, countries that have taken steps and taken a health-based approach to this issue. And again, health professionals are saying this is the first steps that have to happen. Decriminalization and a safe supply. Of course, we've got to invest heavily in supports for people that are living with substance abuse disorder, people that the wraparound supports, affordable housing, of course, and access to mental health supports, ensuring that we're spending money on prevention and education and harm reduction. But these are the most important two steps that we could start with. And if we're really going to end the stigma and treat it as a health crisis that it is, the government needs to act. No more half measures.
What was her response? You said you urged her to accept BC's application.
She said that they would look at it, but we've heard this for 6 years from Justin Trudeau. Mums and dads are losing their sons and daughters across this country, and kids are losing their parents. And this is unacceptable. These are preventable deaths that could be saved, lives that could be saved. And it's impacting cities and rural Canada. It's touching us as MPs. We're losing our constituents. No one is left untouched in this country by the mental health and addictions crisis that's taking place. And we haven't seen the government respond, with the rigor and the necessary steps and understanding that how serious this issue is. Where are they? Why is the Prime Minister not doing it? Because the stigma starts with him. The stigma starts with Justin Trudeau. He's not taking action. Why? Why is he ignoring his own health professionals when it comes to the overdose crisis? But when it comes to COVID-19, he says that's what's going to give him guidance in his policy direction. It's the stigma. So until he removes the stigma, until he removes the criminal element to the way they're treating this issue and treat it truly as a health issue, then it's on Justin Trudeau.
You mentioned, just for the sake of the argument, so you say that this stigma costs lives, but we know those people, they die because they consume a drug that's laced with other molecules. Can you explain how the fact that it's decriminalized, that it would change that actual situation, that these drugs are laced with other molecules? Can you just explain the process?
Well, thank you for the question. And I think that really, if we're treating it as a health issue and we're not criminalizing people, then they're going to seek the supports they need, whether it be harm reduction services. They're not going to be using in the back rooms of our country, hiding to use illicit drugs. They're going to come out and get the supports they need. And it has to be done with a safe supply. There's no question about it. But criminalizing people with a health issue, we know that's not the right approach. That's not going to help people, deal with the challenges that they face or get the help that they need. Absolutely, we need both. They go hand in hand. But we know that. Absolutely, but we've also seen jurisdictions where they've decriminalized. Look at Portugal. They had the highest overdose rate in Europe when they brought in their policies to reform how they looked at substance use in their country. Now they have the second lowest. So there is countries out there that have taken a health approach when it comes to, and I'm not saying that we have to apply their approach. In Canada, we have to create a Made in Canada approach. But we have to decriminalize and provide a safe supply. Now this is supported by the chiefs across this country, police chiefs across this country. It's supported by medical health professionals right across this country, including my own medical health officer in British Columbia, Dr. Bonnie Henry, and all 4 medical health officers on Vancouver Island, where I live. They're all calling for it. From the Canadian Mental Health Association to the Canadian Medical Association, we're hearing them say these are like really critical first steps that have to be taken. So I guess we're wondering, why isn't the government listening to their own health professionals and their own expert panel on substance use, which has made this their top recommendations? Why? That's the question, I hope that you're going to be asking, Minister Bennett and the Prime Minister.
Are we seeing that with the government tabling this bill in mandatory minimums? And also, I believe in this bill there is this process so that you take people from being prosecuted in criminal courts to courts to deal with drugs and stuff like that. Isn't that a step in the right direction at least?
There's still a criminal element to it. They're still being criminalized. They're not being treated as patients in the health system. They're still being criminalized. This is going to keep people hiding from coming forward and getting the support they need. People are worried about their drugs being taken from them. They're using drugs alone. Many people are dying alone, and people are still buying drugs that are, on the street, that aren't regulated, that are poisoned, and that's what's killing people. So we need to do both. We need to decriminalize and provide a safe supply. Now, the government's saying they support a safe supply, but there's only 120 Canadians across this country that are getting access to, heroin, for example. Fully getting a safe supply. So, I mean, they're not moving in the way that we could. I was just on the downtown east side. They said that could be scaled up to 1,000 immediately if the government was really there to support a safe supply. So we need the government to act, and lives are at stake. We're losing over 20 lives a day in Canada right now. It's got to stop. And Parliament and the government needs to take action before the holidays. We can't wait until February, until the House resumes. It's time for action. And, this is something that you go into every community in this country, and it's getting worse. The poison drug supply is killing more and more people, and it's spiking the amount of deaths that are taking place in our country. It's a tragedy.
Sur les Jeux olympiques, est-ce que le Canada devrait suivre l'exemple des États-Unis?
Nous, au NPD, depuis longtemps, on est en faveur d'un boycott diplomatique des Jeux de Pékin. Ça serait un geste fort que le Canada poserait. Je pense que M. Biden vient de ouvrir la voie et on espère que le gouvernement libéral va prendre ça très, très au sérieux. Vous savez, on a voté en Chambre ici que ce qui se passe avec les Ouïghours, c'est un génocide. Mais les droits de la personne sont tellement bafoués en Chine. On parle des Ouïghours, mais également le Tibet, la répression à Hong Kong. Je pense que le monde, la communauté internationale doit envoyer un message fort à la Chine qu'ils ne peuvent pas continuer dans cette direction-là, puis il n'y a pas d'impunité.
Qu'est-ce qui explique que ça prenne autant de temps que le Canada consulte ses alliés?
Je n'ai aucune idée. Vous posez la question au gouvernement libéral. Je pense qu'il devrait être capable de rapidement prendre une décision là-dessus.
Juste un boycott diplomatique, ça prend quelle forme? Juste savoir, c'est pas le premier ministre, c'est pas la ministre, c'est pas le diplomate, c'est quoi exactement?
Toutes ces réponses. Pas de premier ministre, pas de ministre, pas de représentant du gouvernement.
Could we get your response in English?
Yes, I think that the Liberal government should follow the lead by President Biden to exert a diplomatic boycott on the Olympic Games in China. If we are serious about defending human rights, we voted in this parliament that what's happening to the Uyghur is a genocide. So we need strong action. This is a strong gesture that should be taken by the Liberal government. I hope Mr. Trudeau will follow Mr. Biden.
Thank you very much.
Merci.